Has it? Oh, got it.
Okay. So we did the self-care deficit theory by Dorothea Orem. So who is Dorothea Orem? She was born July 15th, 1914 in Baltimore, Maryland. She earned her nursing diploma in the early 1930s from Providence Hospital School of Nursing in Washington, D.C. She then went on to complete her bachelor's in 1939 and then her master's in 1945 from the Catholic University of America in Washington, D.C. She's known to have a distinguished career in nursing and has also earned several honorary doctorate degrees. She earned many awards, including the Catholic University of America Alumni Achievement Award for Nursing Theory in 1980, the Linda Richards Award from the National League for Nursing in 1991, and she was named an honorary fellow of the American Academy of Nursing in 1992, along with many other awards. But what she's most known for is developing the self-care deficit theory, also called the Orem model of nursing, which was developed solely by Dorothea Orem from the years 1959 to 2001. Some more about Dorothea Orem. She had many different important nursing positions. She was a part of the directorship of both the nursing school and the nursing department at Providence Hospital for 9 years. She also taught biological sciences and nursing for a couple of years at the Catholic University of America. She also served as the assistant professor from 1959 to 1964, an associate professor until 1970, and was dean of the School of Nursing from 1965 to 1966. She was also the curriculum consultant to the Office of Education, United States Department of Health, Education and Welfare, Practical Nurse Section in 1958, 59, and 1960. She was a part of the Indiana State Board of Health from 1949 to 1957, and to the Center for Experimentation and Development in Nursing, the Johns Hopkins Hospital from 1969 to 1971, and to the Director of Nursing, the Johns Hopkins Hospital from 1975 to 1976. She was also a part of a group of nursing theorists who helped establish the framework for nursing diagnosis in 1982. More about Dorothea is that she also created great works. She helped publish guidelines for developing curriculum for the education of practical nurses in 1959, and she was the author of the book Nursing Concepts of Practice, which I put a picture of right there. In that book, she outlines her nursing theory, the self-care deficit theory of nursing. She authored and edited many other works and also spoke at many conferences around the world during her lifetime. Unfortunately, Dorothea Orem passed away June 22nd, 2007, but her legacy is still carried on today when we practice her theory. The International Orem Society was developed to further research and develop Dorothea's nursing theories. Now getting into the theory. The central philosophy behind the self-care deficit theory is that all patients want to be able to care for themselves, and most recover faster if they do as much for themselves as they can. This theory is primarily used in rehab or primary care settings where patients are encouraged to be independent as possible, but this theory is very broad and involves many different concepts, so it's used in all different aspects and scopes of nursing. And here's a quote. It just says, "The theory defines nursing as the act of assisting others in the provision and management of self-care to maintain or improve human functioning at the home level of effectiveness. It focuses on each individual's ability to perform self-care, defined as the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being." So that just tells what the theory defines nursing as and self-care. So then jumping into the analysis of the theory, this is a grand theory because it covers a broad scope of nursing with general concepts that can be applied to all fields of nursing. It was developed as a result of Dorothea Orem working towards her goal of improving nursing quality in hospitals in her state, and she was the only one behind the theory. And then within the theory, there are three interrelated theories, which are theory of self-care deficit, and theory of nursing systems. So the theory of self-care it focuses on the activities that people do to maintain health and well-being. These are also referred to as your ADLs. And there are three categories within the theory of self-care. So the first is the universal self-care requisites, and these are more of like the basic ADLs in your human functioning. It covers someone being able to cover their basic needs, such as getting food, water, air, so breathing, and then safety. Also, elimination, proper rest. And then the second is developmental self-care requisites. And these are either universal self-care requisites that have been particularized for developmental processes, or they are new requisites derived from a condition or associated with an event, and that's further separated into maturational and situational. Maturational is the patient progressing to a higher level of development, and situational is the patient preventing themselves against harmful effects in development. And then the last one is health deviation requisites. And these are needs that appear based on the patient's condition and are required in conditions of illness, injury, or any other self-care deficit. And this would include the patient being able to seek care, the patient kind of like being aware of signs or symptoms of different illnesses and conditions, the patient adhering to their medication and treatments, and then learning to accept their medical conditions. So within these three different categories, if a patient is unable to meet any of these self-care requisites or necessities, that's when a self-care deficit occurs, and that's when the nurse steps in and provides support, which can be total, partial, or just education. And then the second theory of self-care deficit explains when nursing is needed for a patient. So this is when the patient is incapable of providing self-care, so they need nursing. And then Orem just describes 5 methods of help, which just involve doing stuff for others, guiding others, supporting others, providing a good environment, and then education. And then the last is the theory of nursing practice, and this describes the relationship between the patient and the nurse. So this can be when the patient isn't able to perform self-care and they have the nurse. So it can be total compensatory. So in that instance, you can think of the patient, everything needs to be done for them by the nurse. It's kind of like caring for a newborn. They rely on the nurse to survive. And then partial compensatory, which would be like helping a patient walk to the bathroom or helping them eat their meal, or support or education system, which would just be like educating the patient on, taking their medication and stuff like that. Okay. So then major assumptions of the theory. The major assumptions are to stay alive and remain functional. Humans engage in constant communication and connect among themselves and their environment. Also, the power to act deliberately is exercised to identify needs and to make needed judgments. Mature human beings experience privations in the form of action and care of self and others involving making life-sustaining and functioning regulating actions. Human agency is exercised in discovering, developing, and transmitting to others ways and means to identify needs for and make inputs into self and others. And lastly, groups of human beings with structured relationships cluster tasks and allocate responsibilities for providing care to group members. So the content of the theory. So the theory's content is organized by the meta paradigm. So the meta paradigm consists of 4 parts. So nursing would be the nursing actions. The person would be the recipient of care, so the patient. The health is what's defined by the person and what constitutes for a self-care deficit in nursing. And then the environment are the internal and external factors of the patient. Okay. So then the concepts of this theory are nursing, humans, environment, health, self-care agency, basic conditioning factors, therapeutic self-care demand, self-care deficit, nursing agency, and nursing system. So the concepts are related because humans' environments impacts their health and ability to perform self-care. Self-care maintains health. Self-care agency is the ability to engage in self-care. A self-care deficit requires nursing. Nursing agency allows others to meet their therapeutic self-care demand. And nursing system is activated when patients' therapeutic self-care demands exceeds that of the available self-care agency, which leads to nursing. And this is the made-up case study. So Norma Jean is a 67-year-old female living at home by herself along with her kitten. Lately, Norma has been misplacing common household items like her keys, forgetting to feed her kitten, missing days of her medication, wearing the same clothes for days, and failing to perform her ADLs. Her granddaughter decided to check up on her after a phone call with Norma, where she sounded very thought disorganized. Her granddaughter reported Norma's apartment was messy, smelt of urine, and her grandmother couldn't recall the last time she ate food or showered. Norma's granddaughter brought her to the hospital where she was diagnosed with dementia and several nursing diagnoses, including self-care deficit. Norma's dementia has altered her ability to care for herself and her kitten and has deemed her situation unsafe for her to live alone. Because Norma's therapeutic self-care needs have exceeded her self-care agency, she needs nursing help to assist with her self-care needs. Norma was admitted to a med-surg unit for further monitoring and to replenish her fluids and electrolytes. So this is Norma. I just put the situation. She's admitted to a med-surg floor due to confusion and medication non-compliance. Her background is that she has hypertension, hyperlipidemia, COPD, and she's a former smoker. Her assessment, her blood pressure is a little high. She has a normal temperature, normal heart rate, normal oxygen saturation, and normal respiratory rate. The patient is confused but is oriented to self in place. My recommendation is to utilize the self-care deficit theory in this situation to determine the amount of nursing needed. So evaluating the case study. The patient's unable to complete her ADL. She's unable to care for herself and others, her kitten in this situation, and she's unable to maintain safety. If she's forgetful, she could fall. This leads to a need for nursing in order to compensate for the patient's self-care needs. The use of the self-care theory in this situation would be essential to measuring the ability of the patient to complete their ADLs and assess safety in their environment. So then the meta paradigm, the person is Norma Jean. She's the patient affected in the situation. Her health has been impacted by her dementia diagnosis and the inability for her to perform her self-care. Her environment is her home. It's disorganized and unsafe for her to live at alone. And nursing is needed to assist Norma with her self-care deficit. So then to conclude the case study, Norma's discharged to live with her granddaughter and also receive visits daily from a caregiver. The caregiver will be there to assist Norma with ADLs and ensure she's taking her medication properly. This is how partial compensation of nursing is utilized. It's going to allow Norma to still feel like independent while accepting her diagnosis during this time and still having a sense of normalcy while living at home. But because Norma's health will continue to decline due to the progressive disease, the self-care deficit model will be utilized throughout her plan of care.
Okay, Hannah, that was dope. Great job. So now we're going to move on to evaluation of theory. So the purpose of the theory, as you can see, help nurses to better help patients. The theory was created as a new way of thinking about nursing that you can apply clinically to help your patient. So the nurse determines what is most important regarding the patient and also encourages the patient's autonomy. This will inevitably improve the patient's health and recovery. In terms of scope, the theory applies globally, and as Hannah said, it's a grand theory. so it can apply in all patient interactions and it should be used clinically, but you can also find it in any type of nursing, so including education. Say you're in school learning about the holistic approach in nursing, or during planning patient care and recovery with other healthcare professionals. At its core, this theory promotes our innate self-sufficiency and responsibility to take care of ourselves and get our needs met. It's what's best for our health to be self-sufficient. Nursing, at its core, is holistic care, as we all know. We as nurses create relationships with our patients, assess what needs are most important, and work together with our patients to help them return to self-sufficiency or their best version of self-sufficiency. This theory is widely accepted and used around the world, and like I said, in basically all clinical settings and patient interactions. Patient outcome is probably the best way to test this theory. If you think about it, we test our patients' self-care ability every day when we assess them. How is their general appearance? Are they taking care of themselves? Do they adhere to their medications? Do they want to be involved in their care? Do they need education on involving themselves in their care? So how they're doing and stuff like that is probably the best way to test it. So in this article that I found, they used the self-care deficit theory in their research on people with long-term conditions and how they best care for themselves. This one particularly used Parkinson's, and it was kind of like a questionnaire interview type research where they found out that there's these 3 themes that are most interrelated building blocks used in the development and maintaining of self-care. So these 3 themes were a changed reality. So if you think about it, if you have Parkinson's, your reality changes. That's kind of what it means. Your companion, so your support, and finding a new path. So these 3 themes they found were essential to developing self-care. And then, yep, you heard it, they were then used to create nursing interventions. So if that's not applying theory to a clinical situation, then I don't know what is. So as I said, they use the themes to then create nursing intervention. So I'll read just a couple of them, but as you can see, in terms of a changed reality, which is kind of like an emotional, like mental change that occurs with someone with Parkinson's. So obviously that can really interact how they take care of themselves. Some nursing interventions to kind of assess, but also take care of that patient include encourage speaking openly about the diagnosis, acknowledge their feelings. So these are things that nurses do anyway when a patient is ill, but they're just more specific to Parkinson's and also helping this person get to self-care. And then a couple other good ones are, so in finding a new path, some of them, promote physical activities, promote giving advice, introduce new cognitive self-management strategies, and then arrange for the patient and the care partner to meet others in the same situation. So you're kind of like encouraging the patient to like get more support and like get out there a little bit more. Ta-da!
And this is just a quote that talks about how the Orem International Society was founded to continue the legacy of Dorothea Orem's research and advocacy. And they still experiment with this theory today. They still do research and they still talk about Dorothea Orem in nursing. And then this is our works cited.
Woohoo!
I don't know how to stop the recording.